A spike in recent valley fever cases in Arizona has health officials concerned and looking into what could be causing a rise in the disease. Valley fever usually affects a person's lungs and is caused by fungus in the soil. People who breathe in this fungus can experience pneumonia-like symptoms, including fever, cough, and fatigue. 9 News Side's Ricky Mitchell spoke to a local expert about this recent increase and has more on tonight's health alert.
Yeah, Stella, Arizona has seen a 107% increase in valley fever cases between June and October of this year compared to the same time frame last year. In Pima County, we've seen a 97% increase in cases. And since this can be a very serious disease for some, experts are looking at why cases have spiked.
Tucson saw above average rainfall last year during September, October, and December. And that rainfall is likely the reason why officials are now seeing more valley fever cases.
It's on an uptick now.
Dr. John Galgiani is the director of the Valley Fever Center for Excellence at the University of Arizona. He says there's a strong relationship between weather and valley fever.
The fungus grows in the soil. And so we think in the wintertime, if it's rainy, there's a bloom in the soil, and so that makes available more spores to get in the air when things dry out.
According to the Arizona Department of Health, there are 6,478 confirmed cases of valley fever so far in Arizona. That's compared to just over 5,600 cases in all of 2014. The disease also contributed to 42 deaths last year. And with El Nino increasing our chances for more rainfall this winter, Dr. Galgiani predicts a significant rise in valley fever cases next year.
That means more people are going to get sick, and it's going to be more important for doctors to be thinking about that.
And the U of A has sponsored an antifungal drug that experts say could cure the disease. They're also working on a vaccine, but both are still a few years away from being on the market, mostly due to a lack of funding. Until then, experts say awareness is key so people can receive the correct diagnosis. Stella?